Well, Dr Youssef El-Gingihy is a GP and author of How to Dismantle the NHS in 10 Easy Steps. Many thanks for joining us at this lunchtime on Sky News. We heard from members of that local community there in Banbury, clearly deeply concerned about what effects these changes will have on them.
Yes, well, this is part of the government, what's known as the government's sustainability and transformation footprints, and you really need a glossary actually to define these terms. Sustainability, as we've heard, means massive cuts. So it's part of a programme of £22 billion in cuts over the next 5 years, taking us to 2020. And those cuts mean obviously cuts to hospital services, hospital closures, mergers, and it means the sell-off, permanent sell-off of NHS land and assets. And then the second part of that equation, transformation, really means adopting unproven models of care, some of which is linked to privatization.
You hear time and again from politicians hailing the NHS as perhaps one of the best institutions that Britain has to offer. So how do we get ourselves into a position where come 2020, 2021, we're going to have this shortfall in funding?
Well, exactly. This is a narrative of around unaffordability, which is largely bogus, because if you compare our spending to other European countries, we're significantly below. If you really want to find savings in the NHS, then it's interesting with the timing of this coming out now that you've just had, of course, Jeremy Corbyn announcing Labour's plans to renationalise the NHS. And if you want to find savings, then you would want to look at things like PFR. You'd want to look at removing the market and restoring the NHS as a publicly provided, owned and accountable health service.
And presumably there are some of these changes that have been discussed, that are being looked into, that could perhaps benefit patients. For example, virtual consultations as one example. We live in a modern age, and perhaps that's in line with the modern age that we live in.
Well, we absolutely have to harness technology, but what we're seeing, if you look at the NHS 5-year plan and other documents, is the use of for example, telehealth, the use of technology, Skype consultations, as you've mentioned, also self-care and pharmacies as a substitute actually for high-quality medical and nursing care, and that's just simply not good enough. And the evidence actually for what this is termed is integrated care, which means it's being sold as care in the community. The evidence for this is unproven. So our policies for a long time now, for the best part of several decades, have not been evidence-based. And we have to really think about, when we're looking at something like integrated care, that's actually being imported. Integrated healthcare sounds great, but it's being imported from the US. And this ties in with this massive program of cuts and hospital closures. And there isn't going to be the investment in GP or community services. So what you're going to end up with, unfortunately, because we're already in a situation of manufactured crisis, this is going to make it much, much worse. What you're going to end up with is a situation where care is actually being denied on a significant basis, and what you've heard, obviously, from campaigners and from patients there in the news clip, is that as far as patients are concerned, so the elderly and the very young and young mothers, is that they will have to travel much further to access services.
We are where we are, and advocates of these changes will say that there's nothing that we can do about it. There is going to be this shortfall in funding, so these cuts, these changes that are being discussed are inevitable.
Well, that's certainly one possible endpoint or destination for this, which is, of course, if you adopt this US model of integrated care and you have a massive program of cuts and centralization, you will then, of course, get a two-tier service, with the majority of ordinary people having to rely on a third-class service, and a minority of affluent people being able to get private healthcare insurance. There's nothing inevitable about that, and there will be a huge amount of resistance, particularly from local campaigns, because when we're looking at legislation, such as, for example, the Privatization Act, the Health and Social Care Act we saw in the last Parliament, that's something that's quite abstract for people to grapple with. But when it's the local hospital at the end of the road that's closing, that's something that becomes very concrete, and you see a huge amount of resistance to that, and often those plans have to be delayed or shelved.
OK, Dr Youssef El-Gingihy, very interesting talking to you. Thanks for joining us this afternoon on Sky News.